Again, ladies and gentlemen, distinguished guests, very good morning to you all, and welcome to our bi-monthly breakfast meeting. Please allow me to greet in Japanese as well. 皆様おはようございます。本日はご登壇者を海外からお招きしておりますので、英語にて進行させていただきたく存じます。同時通訳が入ってございます。そして、質疑等のお時間ではですね、ぜひ日本語でもご発議いただければと思います。同時通訳は、チャンネル1が日本語、チャンネル2が英語となっております。Again, good morning, everyone. This bi-monthly meeting, breakfast meeting is aiming to introduce the latest health policy agenda, as well as to express our great appreciation on especially to our advisory members and as well as the industry partners. Obviously, everyone here is a distinguished guest, but today we'd like to especially thank the attendance of Your Excellency Ambassador Richard Ramonetti, Ambassador of Kingdom of Lesotho to Japan. Ambassador. And we also would like to thank you, Your Excellency, Dr. Masato Nobitani, Assistant Minister for Ministry of Health and Labour Development, and his colleagues from MHLW. On this occasion, we are pleased to welcome two international special experts on their visit to Japan to participate on NCD Japan Forum 2011 that will take place this afternoon at the British Embassy, as well as this breakfast meeting. We are delighted to have Ms. Judith, strategy consultant to the NCD Alliance. Welcome to Tokyo, Judith. It's lovely to have you indeed. And then Ms. Loyce, my good old friend, Director of Health Policy at the world-famous Armstrong Foundation. Welcome back to Tokyo, Judith. I'm Aaron Loyce. Well, each speaker will make a 15-minute presentation beginning with Judith. Judith will focus on the latest NCD's agenda and NCD Alliance momentum activities. Then Loyce will touch the viewpoint of civil society to facilitate the momentum of NCD agenda. I believe both speakers expect certain initiatives and contributions from Japan on NCDs, just rather than changing Prime Minister every year. So please welcome Judith from UK.
Good morning, and thank you very much for inviting me. It's my first visit to Japan and I am thrilled to be here. This morning I'm going to talk about three things. About why tackling non-communicable diseases, and NCDs as we refer to them, is a priority for health, a priority for development, and a priority for all of us. What the NCD Alliance is, what we've done and what we plan to do for the future, and to raise the question about whether Japan can be a global champion for preventing non-communicable diseases. So, what is a non-communicable disease? I don't need to tell you because we all have experience of NCDs. We all know somebody who's battling with cancer, who's living with diabetes, who's become disabled because of emphysema or stroke, or has died of a heart attack. These are the diseases. This is easy. These are the diseases that we all know from our own families and friends. But we do need to explain a bit about why we are now grouping them together and calling them this rather ugly term of a non-communicable disease, and calling for urgent action to prevent them. And really, the term NCD is just really more of a political construct. It's not a and it's quite flexible. But it's an enormous threat to all of our countries. This rather complex slide is from the World Economic Forum global risk landscape, and this up the left-hand side tells you how severe a threat is in billions of dollars, US dollars, and below this axis is the likelihood of it happening. So if you're up in the right-hand corner, it's both very severe risk and it's very likely to happen. And right up there, next to fiscal crisis, is chronic disease. So we're talking about a threat to economic stability that is very high and very likely. Up there with food price volatility, oil price spikes, and it's going to get worse. If we look at this slide, we can see, we've got high income, middle income, and low income countries with the projected deaths in 2015 and 2030 from different types of disease. The infectious diseases, the ones that we know have been the focus of global attention through the Millennium Development Goals, are here at the bottom: HIV, TB, malaria, and other infectious diseases. And then in this pale blue colour, maternal, perinatal, and nutritional diseases. And these, of course, are coming down with the efforts that have been made in low-income countries and middle-income countries. But at the same time, the projected rise in cancer, diabetes, and other non-communicable diseases is really daunting. Of course, everybody has to die of something. And every year there's around 58 million deaths in the year. And around 36 million of them are from NCDs. Of those, about 28 million are in low and middle income countries. But of those 28, 14 million can be prevented. And it's the prevention of disease as well as the treatment of disease that we're focusing on today. For the purposes of this morning, I'm just going to talk about NCDs being the 4x4. That is the 4 big diseases: cardiovascular, diabetes, cancer, and chronic respiratory disease, by the 4 risk factors: tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. And the UN summit that happened in September focused on these 4x4. There was, of course, discussion of mental health, of oral health, renal health. It is not that NCDs does not cover these other issues, but the 4x4 model accounts for the vast majority of NCD disease and death. And these 4 risk factors, you can see just how common they are for each of the 4 diseases. And the biggest single preventable cause of NCD mortality and morbidity is tobacco use, followed by fast food, not the delicious food that people are eating, physical inactivity, and the real killer when physical inactivity and poor diet are combined, and this is the time bomb that we are leaving with our children, and not just children in affluent countries. There's a very high and rising percentage of children, even in low-income countries and middle-income countries, who are suffering from obesity. And harmful use of alcohol. But I want to come back just to the top one, the one that's the single biggest preventable cause of disease and death, and that's tobacco use. Because tobacco use is responsible for a huge proportion of global deaths. By 2015, really just around the corner, it's going to be responsible for 10% of all deaths. Not 10% of NCD deaths or tobacco-related conditions. This is 10% of all deaths. And so if we want to do something about cancer, one-third of all cancers are tobacco-caused. About a third of all respiratory diseases and a third of all cardiovascular diseases are caused by tobacco. Well, we have to eat, but we don't need to smoke or use tobacco. And apologies for this rather gruesome next slide during your breakfast, but this is what the tobacco diseases really look like. And here's just a quick recap of the 16 different types of cancer caused by tobacco use. And the long list of respiratory diseases and cardiovascular diseases and other conditions caused by tobacco use. So my background works on tobacco, so you would understand why I'm passionate about that subject, but I'm in good company because speaking at Davos this year, Dr. Margaret Chan suggested, let me propose a critical priority. Tobacco, tobacco, tobacco. We must fight it. Now she's obviously the director of the World Health Organization, but we have here Secretary General Ban Ki-moon, Secretary General of the United Nations, and when he was talking in 2009, so already 2 years ago, about NCDs, he said this, that cancer, diabetes, heart diseases are no longer the diseases of the wealthy. Today they hamper the people and the economies of the poorest populations even more than infectious diseases. And this represents a public health emergency in slow motion. So that's where the NCD Alliance comes into the story. And this is an alliance that was set up in 2009, initially by 3 global federations of diabetes, heart, and cancer. These are the global non-government organisations that have members in most countries in the world. They were joined quickly by others, including Livestrong, which Loyce will talk about shortly, American Cancer Society, a good partner of the Institute, and others. And the organisation that I was working with at the time, the Framework Convention Alliance on Tobacco Control. More non-government organisations have joined since, including most recently the Alzheimer's Disease International. And then a great many private sector enterprises who I'm sure many of whom are represented in breakfast today, who have been a terrific support to the NCD Alliance. We set out with 4 major asks, and the first one of which was a summit at the UN on NCDs. The second was to link NCDs to the Millennium Development Goals, the MDGs,